Hello. Tell me.
So my 7-year-old son, he has fever and cough since past 2 days.
Yeah. So?
So he's 7-year-old. He's having fever and cough since past 2 days.
Okay. Okay, just maintain temperature record.
Okay.
Give him paracetamol when needed. And I prescribe him co-amoxicillin. Give it 5 ml twice a day for 5 days.
Co-amoxicillin is
Antibiotic.
antibiotic. Is there anything serious?
No, nothing serious.
But there
In
is
fact, many mothers ask for an antibiotic.
Okay.
Give it and he'll be fine.
Alright. Thank you, doctor. Thank you. Come. Thank you.
Bye.
So may I come in?
Please come in.
So sir, my son has fever and cough since
Yes.
2 days.
Yes.
And this is the prescription that my doctor gave.
Yes.
So he said there's an antibiotic in that. Is it necessary, sir? An antibiotic?
Well, madam, he may be right. However, antibiotic is rarely necessary to be prescribed in the first 2-3 days of fever. But I'm sure your doctor may have seen some evidence of a bacterial infection and therefore he has prescribed an antibiotic. I wish he should have probably counseled you, communicated with you, and even documented. That would have made you happy to continue with his advice.
True. Thank you, sir.
Hello, sir. How are you?
Hello, how are you?
So I think one of my patients came to you whom I
Yes.
prescribed an antibiotic.
Yes, it is.
So I thought I was running into a risk withholding antibiotic, and I thought I would miss a serious infection.
Yes.
That's why I prescribed one.
I understand you. But it's not very difficult to evaluate the risk in a given patient. If you look at the behavior of the child and the urine output and check the heart rate and respiratory rate, and if it is proportionate to the expected, then be sure there is no risk involved at all. Especially if the infant beyond 3 to 6 months of age and a child who has no other comorbidity. So, it's not a risk at all. Be confident, wait, counsel, and communicate with the patient and document it. You will never be wrong.
Agreed, sir, but I thought it would not do really any harm to the child, so I prescribed one.
No, there are a lot of harms. To an individual, antibiotic may cause diarrhea or a skin rash, but much beyond that, there is a bigger problem. If irrational use of antibiotic is continued by all of us, there would be lot of many organisms, germs, which were resistant to all antibiotics. And this is a problem all over the world. It's rampant everywhere. And very soon, the day may not be too far before no antibiotic may work. So remember, it's not only the safety of a given child, but the safety of the community at large, all over the world. You understand?
Oh, very often we tend to forget antibiotic can do harm in the long run.
Absolutely. So now remember,
Sure.
use an antibiotic only if you have a reasonable clinical evidence of an acute bacterial infection. Exceptions, a small infant under 3 months or a baby at risk, a child at risk. Otherwise, there is no danger. If all of us follow it, the world will be safe enough and our children will learn to be remaining healthy. Let's do it.
Sure, sir. Thank you so much.
Thank you.